Nowadays, many a mother bring their child for the worry of chicken pox, but the doctor says it is hand, foot and mouth disease. What is this hand, foot and mouth disease? Let us see in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week a simple explanation of a medical topic is given via a video. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon to get instant notification on new content. Today's video is about hand, foot and mouth disease. Before explaining that, we must be clear in one aspect. There are more than 100 reasons for fever with rash. Not all fever with rash is some form of pox, whether it is measles or chicken pox. Even measles or chicken pox are viral diseases, treatment for which is now available. Hence, any fever with rash should be treated by a doctor and not kept at home for fear of this chicken pox or other diseases. Coming to hand, foot and mouth disease, what is the reason, what is the cause for this disease? This is a viral disease. The viruses causing this disease are enterovirus or coxsackie virus. This virus is transmitted like many other diseases via droplet infection or by contact with the individual. What are the symptoms for this disease? This is a classic disease of fever with rash. So there will be fever, which is usually a short lasting fever of 1 to 3 days duration. You may have rashes which usually appear in hands and feet, and you may also have rashes over your knees and elbows and even in the buttocks region. Rarely this may spread to other parts of the body. They have mouth sores or mouth ulcers, which are usually the problematic manifestation. Because rashes, fever, everything goes away, but because of the mouth ulcers, the child is not able to take proper food and hence the problem. What are the complications of this disease? Usually it is a mild disease. It is self-limiting. Usually with or without treatment they come out of it. There are rare complications involving the nervous system and even the heart. But in the last 10 years, where we have seen in Chennai and Tamil Nadu, every year this hand, foot and mouth disease happening, we have hardly seen any complications due to that. So please visit your doctor who will see the child and prescribe the medicines, and if needed treat the complications, which are in fact very rare. What is the most problematic complication what is happening is poor feeding due to the mouth ulcers. Hence, you need to give bland liquid diet so that these ulcers are not irritated and doesn't lead to pain, and hence you may take care of the child at home. How do doctors diagnose this disease? Classic clinical manifestations, if they are present, the doctor may not do any blood test. Just by looking at and asking your history, they may diagnose this disease. If they have doubt, they may order some tests. How to treat this disease? The treatment of this disease is just symptomatic management. What is the meaning? You treat the symptoms, the disease tends to get better by itself. So if there is fever, you will be given antipyretics or fever reducing medicines. If there are rashes, you will be given medicines for that. For the mouth sores, you may be given medicines to alleviate the pain and suffering and for faster healing. By getting just these medicines, your child will be better. Usually this disease affects children and not the adults. If you tide over the present crisis of food intake, the child is going to get better without any complications most of the times. How to prevent this disease? There is no vaccine to this disease. So what is essentially needed, as for most of the diseases, is improvement in personal hygiene. So if you maintain cough hygiene and hand hygiene, you are not likely to spread the disease. Especially children with this disease who have these rashes should not be sent to school or other public places so that they don't infect other children. Similarly, persons who are caring for the children should also maintain personal hygiene so that they don't transmit the disease to other children. So essentially, fever with rash can range from simple diseases like hand, foot, mouth disease to very complex and serious disorders. So any fever with rash should be taken to a doctor and treated accordingly. We have seen little information about hand, foot and mouth disease in today's video. If you like this video, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.